Hello, everyone. This is Doc Holliday, coming to you with a very important question. Today is the Monday, the 21st, and that question is: where is U.S. Naval ship Comfort and Mercy? Um, I don't know if you all have been paying attention, but out in California, they are in a very big crisis as it relates to hospital capacity. Show you right here. Um, Currently, the the LA County Department of Public Health have released this yesterday on the 20th, December the 20th. And let me take myself off the screen here. And what it had stated was that there were basically zero staff adult ICU capacity remaining in Southern California. Zero. They are maxed to the fullest as far as hospital capacities in California, but LA specifically. But my question is where is the different naval stations that were dispatched back in late March and April, or actually April and May of last year? Because if you can recall, they were each one of them. Like I think Mercy was out of San Diego, and Comfort was out of Norfolk, Virginia. But excuse me, right now we're having particular issues with LA County. They have zero hospital capacity, and right now they're having daily cases in LA County alone of 13,000 people every day.
USNS Mercy arrives back at its home port
And
here
that
in
is
San
something
Diego.
that
Navy says
I
that
got
this is the first
stuff planned that I
civilian
ain't want
mission
to have played.
responding on U.S.
Um, that is, how do I say? Let me go back to where I was. 13,000 people is a lot of people, and plus you got 5,549 people daily that happen to go to the hospital daily. These are daily numbers, and they've just been increasing. The dates go in reverse. This is the 1214. This is 1220. So in 1214, you see the daily hospital rates is 4,203, and it goes up each and every day. So with today being the 21st, this might be 57, 5,700 people that are going to be needing hospitalization. And right now, LA County does not have the capacity. They are seriously having people wait or lining up in the hallways. Like, I don't know if because I used to live in LA, and I remember I got into an accident, and I had wanted to go to UCLA hospital to be seen, and even at a normal day, they are overfilled, and you have people waiting outside in the hallways, lining up because there's no more capacities in the rooms and everything, and that is what is going on now. But it's even more of a dire strait because every one of the people that are there are suffering from COVID, and the hospitals are way beyond stretched, and I don't understand why we have not activated at least the U.S. naval ship, what do you call it, Mercy, because Mercy is headquarters or stationed down in San Diego. That's its port station. So it should be able to move up the coast. San Diego ain't nothing but like 2 hours away. Well, by boat, it's probably quicker than that. To go up to LA to help assist them in all of the what do you call it, in all of the daily hospitalizations that are going on. Because I mean, you got a 16.7%, 16.1% 7-day positivity rate. That's insane. That is truly insane. So we LA County needs all the help it can get. And each one of those ships, they would be able to have they have 1,000 normal beds each, but they would be able to convert at least 500 of those beds. I mean, they would convert those 1,000 beds to a 500 bed capacity if they were to take all of the coronavirus patients only. So that would be a huge capacity. That's 500 lives that could be saved. Whereas right now, this is the part where you have people dying when they didn't have to die because there is not the adequate capacity in place to be able to care for them. So the National Guard needs to be activated. The how do you call it? The military needs to be activated to come in and help the communities. I am hoping, I have not heard yet, but I'm hoping that the VA facilities have opened up their doors as well to try to help in the care of the patients as well. Because the military, the VA and the military are backstops to having an all-out just catastrophe. I mean, it already is that, but we have to activate everybody. All hands need to be on deck in order to help, especially these very problem areas. And people, we have got to, number one, remember not to use, where are my masks? Not to use the cotton mask or these surgical masks if you think you're going to be protecting yourself from COVID-19. These masks right here do not protect you from COVID-19. They're not adequate protection. So any kind of cloth mask that doesn't have the N95 filter in it, this is not going to stop COVID. If you have any kind of loose fitting mask, those of you are smaller frame people or like to wear the mask like this or whatever up under your nose, it's not going to help you. So, you breathe in and out of your nose, not in and out of your mouth. Look, I'm holding my breath. Look, no, I'm actually breathing out of my nose instead of my mouth. So put the mask over your nose in order for it to actually work. I mean, unless you want to be a dumbass, unless you want to die. I'm hoping that you don't want to be a dumbass. I'm hoping that you don't want to die. And if that is the case, that you do not want to die, you should do as I say and upgrade your mask. Do not use the cotton crap. Do not use the surgical mask, because the surgical masks, all the ones that everybody in the neighborhood got, they, number one, are not N95. A lot of these masks are bought at different stores, whether Walmart or Home Depot or whatever, Lowe's. All of those masks that you've seen in there, they were not N95 masks. They were only masks that looked like they were N95 and would protect you from COVID. But with these masks and these type of masks, this is minimum protection, minimum protection from the coronavirus. That is why we are having, so many people, what is it now, 270,000 people coming down with COVID every day. It's because People are, number one, not wearing masks. Number two, wearing BS masks that are not going to actually help you that much. And number three, even if they have those kind of masks, they would wear half-ass or up under the chin or, over their eyes. Stupid crap. You know what I mean? Instead of doing what is what is, how do I say, what is the guidelines, or they're not following the guidelines of the CDC as far as how to wear a face mask. Number two thing that they're doing is they are not using the best type of mask to be able to prevent yourself from catching the COVID virus. And the best type of masks are ones that have a seal over your mouth and nose. So therefore, unlike these masks, when they have a seal over your mouth and nose, the air that you breathe will be coming through these filtered stuff in the mask, as opposed to the with this one, when you breathe, air could come in through the sides, especially with you smaller people. Like there are air passageways around the nose and also along the sides of the face, where air could come in and go out from, whereby making the mask that you're actually wearing useless, or because your inhalation and exhalation is most optimum at the point of less resistance. So with this right here, with the mask being a point of greater resistance, the airflow is going to go through these ports here and on the side of your face. That's why a lot of times when you have glasses on and you have the mask on, they fog up. The air is escaping through those vents. And if you were have glasses on your ears, it would do the same thing. Fog up. And, to give an illustration that air is escaping through the sides of the mask. So that is why you want to have a mask that is sealed around your nose and face, to where no air can either come in or escape from your mask without it going through some sort of filtration process. And everybody needs to follow that guidance. And not only for the mask, but you could also have the respirators. Looks like I must have left my respirator in the car. I think, hold on 1 second, let me make sure. Oh, no, I got it right here. Here's my trusty respirator. This is something that you can take with you, every day when you go out of your house. And doing so, again, you have the full protection around the nose and the mouth area. Put this on, and anything that you inhale in, it will inhale through these filters. This particular filter is a P100 filter that you can get through Amazon. This is like it's called a respirator, and it will definitely protect you from all things coronavirus related. So I definitely would recommend people to get this even more so than any of the masks. This is the higher standard. If you are in the medical field, you need to be purchasing this on your own behest, because a lot of them are not going to buy it for you. Why? I don't know. The government, honestly, that should have been a part of the stimulus packages that they keep on are passing. The stimulus package should have included having everybody equipped with a respirator. And stop playing games with this dang on virus, and do the proper things to make sure that every American is actually protected, and that we can move on through this virus. Because right now, unfortunately, the steps that we're taking we're following the same playbooks that Donald Trump has had for the last 10 months or whatever. And though Donald Trump really doesn't care, there are other things that once the Democrats can come into office that they can do, they can be doing right now. Honestly, because you got a lot of governors and everything, they can go and purchase these things right here for the community to make sure that to cut down on the infection rates and everything. Because this is a lot more important than the shots, because number one, the way that they're handing out the shots are not going to the people that need the most. The shots are going to those that are pretty much more well connected and everything, or are in the healthcare field, and they should already be provided these type of things from the hospital staff. I mean, the hospitals themselves. So, you know, but I've covered that in another video. The vaccine should have been distributed out to the communities first. They are the most vulnerable. It should have been given out to the the 16 to 44-year-olds, or because they are the ones that are transmitting the virus most. It should not have been given to those who should know best how to not catch the virus, because you're delaying whatever possible effect that the vaccine could have on the spread of the virus by delaying the distribution to the population that most needs the vaccine. So the government is doing something very stupid, and unfortunately, the Democratic, what is his name, Biden, he doesn't seem to at least vocalize that he has any objections to what it is that Trump is doing, which troubles me. So I'm hoping and I'm praying that the Democrats have a change of policy and spend the $40 a person or whatever to get everyone a respirator. I'm hoping that would happen. But if not, each individual, if you do have the money, please purchase one of these. If you have some extra money, purchase some for other people. Christmas, hey, this is a very good idea. These come in small, medium, and large. As far as the face mask is concerned, these things here are standard edition, and they pop in and off. I mean, on and off. And there are also some. What do I do with the? I don't know. I don't have them. They also have different cartridges and everything that you can put on there, but they just pop. Yeah. They just pop on and off, and like this. If I can do it on camera, it'd be cool, huh? But yeah. But yes, back to the main story though. California, please contact your elected representatives. I mean, you need to contact Governor Newsom, Dianne Feinstein, the VP, Miss Kamala Harris, Eric Swalwell, Devin Nunes, Ted Lieu, Karen Bass, Maxine Waters, Adam Schiff, Tom McClintock, and what is his name? Ken Calvert. You need to contact all of them bad boys and be like, yo, can we get some help out here? Can we get the USS or USNS Mercy to be, deployed in LA? And really, we need both of them over here. We need to go ahead and dispatch Norfolk to get over here as well, if possible. In addition to that, we need to have the whole blasted military, any available person that is a part of the military hospital systems need to be sending their behinds over to these hot spots so we can beat this crap down, because just following the same playbook and waiting on the vaccines is not going to be able to be enough to do what needs to be done to get a handle on these viruses, or on these viruses. So please, people, everyone that is listening to this, please share the video. Please like, share. Hey, please like, share, and subscribe to this channel. And if you could, please share this channel to all of your friends, your family members, because this is information that everybody needs to hear. And plus, we need to make sure that we get as many people as possible contacting these elected officials and telling them, hey, we need to activate the USNS Comfort and Mercy to Los Angeles so that they can be helped. In addition to that, we need to dispatch every medical personnel that we can muster to not only Los Angeles, but any other hot spots that are located throughout the country, because we are definitely on fire right now. I just want to check real quick the numbers for yesterday as well, to see what happened. So yesterday we had 183,000 people. That's on a Sunday. How do you say, test positive for COVID-19 on a Sunday. We had 183,000 and test positive and 1,400 deaths on a Sunday. Just insane, and you can see how much it is that the U.S. is way in the lead of other countries, unfortunately, as it relates to how many people do have coronavirus and how many new people are actually contracting it daily. As you can see here, we are roughly like 4 times as much as the UK is. UK is having on a daily rate. And the same goes for the deaths per day as well. I remember the time we were having these numbers not too long ago, and we thought that was bad. Jeez, this is beyond bad. And on Saturday, it was worse. We had 195,000, almost 196,000 people test positive in the U.S. And 2,600 that had died on yesterday, which is not cool. We need to do better, and the way that we do better is to upgrade our masks. And to also have the staff available to treat everyone, because it's going to keep getting worse. We didn't have a lot of people even report yesterday, so that's not good. California having 41,000 people test positive on a Sunday. Yeah, on a Sunday as well. We had 5 states that didn't even report yesterday. So in each of those states, you can expect 7,000, probably 6,000, another 4,000, another about 5,000, and another like 2,000 here. So that would put us well over 200,000 for new cases that were discovered on yesterday, on Sunday. So if those states had a report yesterday, we would have been over 200,000, which I think would have been a record for the numbers reported on Sunday. But it didn't happen. I mean, those numbers didn't get reported, so unfortunately the record remains. But 41,000, I think this is the most that California has had um, uh, recently. Let's see, where is their curve? Oh wait, I think this is showing really bad, isn't it? More than likely. I apologize. Oh no, they had way more. They've had as much as 60,000 people on a daily. I mean, in one day. That's a lot of people, bro. But look at this. Look at the spike. Oh my gosh. That's bad. That is so bad. Normally when you see uptrends like that, you're looking at you would be normally looking at this in a different context. And in most cases, in different contexts, that would be this type of graph will illustrate a positive things. But unfortunately, we are dealing with the COVID-19 related daily cases that California is having or has had recently. And it's just, all of these are just dailies, just for California alone. It's not good. Not good. Right now, California has over 1 million. It has 1,100 active cases right now. It's really not good. 1,100 active cases right now. The U.S. has 7 million active cases right now, and 10,600,000 cases have been recovered, and we've had a total of 324,000 people, almost 325,000 people that have died from COVID-19. And I'm sure you all know I've already put out that I'm expecting there to be 1 million deaths very, very easily, unfortunately, by July, the 4th of July. We will have 1 million deaths related from COVID-19 by the 4th of July, unfortunately. And it may even be more than that, or the millionth person died may come before that. I'm hoping that people will follow a more stringent protocol to protect themselves, and that people will continue to mask up and not be so comfortable around your neighbors and family or friends, and continue to mask up and continue to utilize better mask choices, that do not include things that look like this. This is a bad mask choice for everyone. So with that being said, I'm going to get out of here. Thank you all for paying attention or coming and joining us today. Please, if you can, like, share, and subscribe to my channel. I really would appreciate everyone sharing it and subscribing, so that more people can realize that the benefits of my channel, and hopefully we'll be able to abate so many people getting sick. But I thank you all very much for taking the time again. My name is Doc Holliday, and you all have a blessed day. Bye-bye. Oh, and yeah, I always forget.